I'm going to ask Dr. Frankle to come up and say a few words, and then Thomas Hartigan to come up as well to go over the service standards.
So, first of all, I want to thank Darren for really loaning me this suit. I don't own one. So I'm here to talk a little bit about physician perspectives, and I titled this, I'm a physician, why does this matter to me? And when Darren asked me to be part of this team 6 months ago or so, I had an answer for that. I said, well, this is going to be great. We're going to get everyone doing the same service standards. It's going to make it a really nice place to work. People are going to be friendly to each other. Patients are going to have a better experience. Our patient satisfaction scores are going to go up. And by the way, patient satisfaction scores are going to be tied to reimbursement. So that's going to be good for us as well. So I had that all in my mind. But also in my mind, I had this idea, you know what? I'm a doctor. And I'm doing most of these things most of the time anyway, so that should be okay, and plus I'm really focused on delivering high-quality psychiatric care to my patients. I studied hard in medical school, I went to residency, I did fellowship, I keep up on the literature, I do CMEs, and that's why my patients are going to rank us high, because I'm providing that high-quality care. So events over the last month of my life have completely changed my perspective on service standards and service excellence. This is my son. He was born January 1st of this year, my wife and I's first child. He's doing wonderfully. He's at home and giving me these dark circles under my eyes. But he was born 6 weeks premature and spent 3 weeks in the NICU at Fletcher Allen. And those were the most stressful 3 weeks of my life, and particularly that first week was incredibly stressful for me. So like any good psychiatrist, I picked a defense mechanism and I went with it. And my defense mechanism was intellectualization. I was going to learn everything I could about neonatology, and I was going to be the most well-read psychiatrist on neonatology in the United States. So when I wasn't in the NICU with him, I was reading articles like high-flow nasal cannula for respiratory support in preterm infants, or an approach to management of hyperbilirubinemia in preterm infants less than 35 weeks of gestation, or importantly, neurodevelopment outcomes in the early CPAP and pulse oximetry trial. So I was reading all of this, and you might say I was a very involved parent. The NICU staff might have a different word for it. But in the background of this, and in the background of all this reading, I want to tell you about an interaction I had with 2 nurses on the NICU. So I was really focused on knowing everything I possibly could. So nurse 1 had been there for years. She was a really well-seasoned NICU nurse. She knew her stuff really, really well. Nurse 2 that I'm going to talk about, first job out of nursing school. It was clear that I knew more about normograms and bilirubin normograms in preterm infants than she did. For those of you that are interested, there are none in preterm infants. So one time, my wife and I were at the side of my son's isolette, and nurse 1 was there. She had answered all our questions, and then she went away, and we had another question that came up. It was nothing major. Maybe when did he last poop, or when did he last get fed? Nothing big, but we were kind of waiting around for her to come back to ask that question. And we're waiting a little while longer. So I start to poke around and see what's going on. And I see her at the nurse's station on the phone. And I walk by and I eavesdrop and I hear what's going on. And it's clear she's on a personal call, making plans for later on in the week. And I go back and tell my wife, and we kind of stand there next to each other, kind of a little stressed out. Now, I'm not saying she's doing anything wrong. She may have been on a break. She didn't have to come address our questions. She had already done that. But our feeling was, it's a little perturbed. I'd like to get the answer to this question, even though it's not a really urgent question. Now, nurse number 2, my interactions with her, every time I walked into the NICU, if she wasn't busy with another baby, she was coming over to me and telling me what was going on with my son. She told me about the labs, when he last fed, how much his weight was, gave me all the details. If I had a question about labs, she'd pull them up on the computer and show them to me. or studies, she'd do the same. If she was with another baby, she'd look at me and make eye contact and say, give me some encouraging words, he's doing great, or I just changed him, or I just fed him, I'll be right over to you when I'm finished here. And she also made him this, which hung on his isolette through the whole time he was in the NICU, and now hangs in his room. So I ask you guys, which nurse do you think I wanted to see every time I walked into that NICU? Nurse 2. You're damn right I did. And that confused me because I thought I was very intellectual, and it bothered me. I said, what's wrong with me? Why do I care so much about Nurse 2 when I know Nurse 1 knows a lot more information than Nurse 2? And I've been reading about service standards and reading about service excellence and thinking a lot about this. And I think I've come to the conclusion about why. I mean, everyone, we've heard about this. It's important to be cared for. So back to my question. I'm a physician. Why does this matter to me? Well, as physicians, and as hospitals and as the organization, we measure quality of care by outcomes. So we're focused on lengths of stay, readmission rates, infection rates, and so on. And those are really important things for us to be measuring. But it's unreasonable and not possible for our patients to judge the quality of care by the outcomes. It's not reasonable because when they walk through our door, they're expecting the highest quality of care in the United States. That's just a given. In 2013, when you walk into a hospital, you're expecting a high level of care. And it's not realistic for them to base their assessment of the quality of care on the same outcome measures that we provide. I'll tell you this. I don't have any idea whether CPAP or high-flow nasal oxygen is more important or better for a preterm infant who's in respiratory distress. I've read all the articles. I've read the research. It's kind of equivocal. So what I'm relying on is I'm relying on the doctor in the NICU, the neonatal team, to take their years of training, their experience with thousands of babies, synthesize that, and make a decision for the care of my son at that moment that takes all of that into account. And that's really the art of medicine. And as a patient, we don't have the ability to judge the quality of each of those little decisions that are made by the clinical team. Patients judge their decisions and judge the quality of the care really by their perceptions and their interactions with people. So, I'm a physician. Why does service standards, service excellence matter to me? Because I want my patients to know that I worked really hard in med school. I did residency, I did a fellowship, I keep reading, I keep doing CMEs, and I'm providing the best level of care to them that I possibly can. The only way they know that is by their interactions with everyone else in this hospital every second they walk in the door. It's not just with their interactions with me. And so that's why this is really important to all of us as physicians, because if we want our patients to know that they're getting the highest quality of care, we have to expect that everyone in the hospital will live these service standards and will strive for service excellence, ourselves included. And just to finish on a quote, this is from the Fred Lee's book about 9.5 things you'd do differently if Disney ran your hospital. Outcomes are delivered by teams, whereas perceptions are delivered by individuals. So I think everyone in this room relies on everyone else in their individual interactions with patients to show that we are providing really high level care. So thank you. And Thomas and I will